Alright, so we're going to demonstrate how we do our chiropractic adjustments at back pain chiropractic centers. We start with the thoracics, then side posture, then cervicals in the supine position. So now the first thing I do when I put the patient on the table, I do a little bit of the, first of all I palpate, and we can see that Fidencia has a very stiff, rigid spine. This is what you're going to find in all Jamaican and Caribbean spines, unusual, extreme stiffness. So I like to do a little stretch. It helps me get an idea how fibrotic the ligaments are, and it promotes the flow of the cerebrospinal fluid, which brings nutrition to the spinal cord. So now she has a T1, and everybody in Jamaica has T1. So now we're just going to kind of come in here and get a nice little contact on this bone. Okay. And it didn't really move yet because she's very fibrotic. So now, watch the move. We're just going to come in and give a nice gentle thrust. And you feel the bone move right there, right, Fidencia?
Yes, it did.
And we're not going to depth charge the patients like they're teaching at Palmer and Life, where you explode the hell out of the thoracics and you wonder why the patient never comes back. An adjustment in the thoracics is not really the proverbial high velocity thrust. And so you can also take your contacts under the spinuses and see what it'll give you. But see, here's what you do. You take out your tissue pull, and then you take it down, and it's just a nice little gentle set. See that? Feel that bone move? Mm-hmm. All right, now we're going to demonstrate side posture. She's very rigid all the way down, and we have a body left L5. And now we're testing the sacrum, and her left SI joint is locked, which tells us that her sacrum is actually tilted downward and inferior with respect to the sacral base on the left side. So now, Fidencia, what I'm going to ask you to do is turn on your side facing me. The thing I want you to notice, we have the hip come over a little bit more, right on the very edge of the table. Now at Palmer, they used to teach have it back in the middle of the table, and we wondered why the bone would never move. Let me show you how easy it is. Bend one leg, please. And let me have this leg. Let me move it, freely move it. Straighten this leg, please. So now look, I want you to notice the position of my right thigh. You see I'm kind of pushing up on her shin. I want to lock her into position for the adjustment. Let me have this arm here. And that's it, just like that. And I want you to grab right here and don't let go, okay? So now watch, I'm going to show you the wrong way first. Like a lot of the guys coming out of Palmer Life, they're just twisting the patient till it kinks at L1, T12, and they feel like the damn thing's going to snap. That's not how you do side posture. See, you're in here, and it's going to be a straight P to A on L5, body right. Feel it moving? Mm-hmm. All right, now come over here, Doc, if you would, and watch. The most important part of this is where my leg is. I'm on her shin. And I'm even using my hip to come down, and I want to lock her down. Once I lock her down, I can move the bone, and I don't have to twist her all the way out like she feels her thoracolumbar junction is going to snap. Turn to the other side. Notice the patient positioning, and watch how I traction the arm. Some of you guys are pulling that arm down like you're trying to stick it into their hip. That's excessive tissue pull. Don't do that. Relax. What you want to do is just pull the shoulder a little bit, and then you have the patient grab right here. Now, some guys like to stabilize right here and do the adjustment. I like to do it this way. Her sacrum is tilted downward on the left side with respect to the sacral base. It's a Logan listing, antero-inferior on the left. I'm going to contact to the right of the second sacral tubercle, and I'm going to adjust it with a clockwise torque, and you can imagine that will straighten out the sacrum. So here we go. Good. They've got some movement there. And if you want to come over and, again, see where my quadriceps is like just below her knee, and I've got her pinned down, right? And then all I have to do is a nice quick set. Now lay on your back. All right, so now we're going to talk about cervicals. Now some of you guys who just got out of Palmer, you come down here for an interview, this is the craziness I'm seeing from you guys. You're taking the head, and you've got the chin flexed into the sternum, and you're trying to, that's not how you do cervicals. There's a reason your instructor is teaching instead of practicing. He doesn't know what the hell he's doing. First of all, at Palmer we were taught to have the neck in a little bit of flexion. So look at the headrest. You can see the headrest. The superior part of the headrest is up. So we have a little bit of inherent flexion there. And you don't have to lift the head because the headrest is holding the head. And so now you can palpate. And she has pretty good rotation to the left. Amazing, because the rest of her spine is almost frozen solid with heavy fibrosis. So now I'm going to turn it this way. Just relax. And we have a body left C7. And there you see that one just moved very nice. And now, let me see what I got here. I got a spinous right C2, or body left C2, and I'm going to take it from the right side. So the head's already slightly in flexion. And see what I'm doing here? I'm just coming in, and there you go. Just like that, a nice quick adjustment. And that is, I want to demonstrate the double, triple, quadruple clutch, right? Now in chiropractic college, we learn just come in and do the adjustment, right? But what I've been doing, and I kind of developed this over the years, because sometimes when you first thrust, the patient tenses up and the bone doesn't move. So I do the double, triple, quadruple thrust, sort of like this. And use about a second or third one, it just drops into place. So that's our adjustment package. That's all we do at Back Pain Chiropractic Centers in Jamaica. We adjust the spine, we do nothing else, leave everything else at home. You come here, you're going to practice chiropractic.